Let's start with the fundamentals. We are borrowing 40 cents of every dollar we spend. Revenue is the lowest it's been as a share of the national income in 60 years. Spending is the highest it's been in 60 years as a share of our national income. We got a problem. And Dr. Kettle, I like very much your formulation with respect to focusing on the things that really require our attention. Increasingly, domestic discretionary spending is consuming a smaller and smaller share of the budget. Mandatory programs, Social Security, Medicare, and the rest, mandatory programs are growing dramatically as a share of the budget. And the annual budget process here is almost exclusively focused on the smaller part of the budget. What's wrong here? We're not putting our time where the dollars are. And of course, this is a change that has occurred gradually over time, and so it's not surprising that we have a process that really is focused on what used to be, not on what is. If we're to focus on what is, I think it would become abundantly clear that our problem, our challenge, is on the mandatory side of the ledger, Social Security, Medicare. We can see it just as clearly as can be. We had hearing after hearing in this committee going at those fundamental questions. What are we going to do about Social Security? What are we going to do about Medicare? We know we're on an unsustainable course. The demographics don't lie. The number of people who are eligible for these programs is going to double over time. And we have not made the fundamental changes necessary to meet those new realities. That takes time. It takes focus, and we need to give this committee a chance to do that. Let me go to the second point, and that is the oversight. Because I think we've got pretty strong consensus. I can't speak for everybody here, but I think we've got very strong consensus going to 2 years. I think the question that we have to resolve is, what do we do with that second year? How do we structure the oversight? And I'd be interested in any recommendations that members of this panel have with respect to the oversight component. How would we manage that second year? And I'd ask each of you in turn for your observations on what we do that second year. Maya, I can start with you.
Okay, Senator, I'll start by saying I could not agree with you more on where the focus needs to be in the budget, of course, that the fact that we spend so much time every year with these knockdown, drag-out fights, and if the American public understood what a small share of the budget we're discussing, while the part that's out of control is sort of going without that necessary oversight, I think they would be shocked. And just we need to turn that on its head, and we need to focus on where the problems are. In terms of the second year, I do think there is always more room for more metrics, more cost-benefit analysis, more oversight, collecting the data. But I think the most important place is to think about how you actually integrate what we already have into the budget process. And I think that this exercise of putting out national priorities, ranking national priorities, and this is an exercise that other countries go through in a much more rigorous way than we do. They actually kind of map out, okay, in health, what are our primary objectives? Is it longer life expectancy? Is it improving quality per dollar? However you describe that, and then mapping all your healthcare problems and programs, and seeing how they lead into that priority, as you've stated it, and how effective they are, and where the overlap and redundancies are. And you can almost see a visual of kind of taking our federal budget and remapping what the different parts of it are doing. And a critical piece of this is bringing in tax expenditures. That's like the shadow budget that gets no oversight. Nobody pays attention to the $1.3 trillion in spending going through the tax code and what's working and what's not and what's being done. If you just look at housing, for instance, our housing policy is all in the tax code. It's not on the spending side. So breaking these apart by topic, ordering our priorities, and then seeing what's working and what's not, I think would be a new way to turn this on its head and use those oversight metrics for a greater purpose.
Good thoughts. Mr. Kendall.
Let me agree with everything that Maya said and add just one, which is a careful examination of baseline budgeting. I think that there's a lot of confusion in the budget debate over what's projections for the baselines. We have competing groups doing competing baselines. We have CBO doing a great job of producing both a current law baseline and and a projected alternative baseline. But there's little discussion about what our baseline is. And so in the off year, especially for the Budget Committee, that would be an ideal topic to really fully flesh out and figure out what should be the assumptions about a realistic baseline.
I'm glad you mentioned that, because I think this is one of the places that there's more tomfoolery going on around here than in any other place. There are more bodies buried in these different baselines than in any other place, and it absolutely is used to fool people, and I've seen it consistently. Dr. Kettle.
Senator, I couldn't agree more with what I've heard, and let me just tick off maybe 5 very quick things that could be the focus of hearings and investigation. The first is that every administration for the last 25 years has had its own management plan, its own performance efforts, and a careful and systematic look asking the administration, regardless of party, to explore and justify what it is that it's doing, explain what it is that it's doing and how it works is an opportunity. Second is the Government Performance and Results Act requires all federal agencies to define their goals and to produce performance targets, and a careful look at how well that's working is an opportunity for the committee's work. The third is that there are some high-value targets that are out there. There, for example, have been substantial efforts made in the Medicare program to improve the purchase of durable equipment, or put differently, to ensure that as we provide wheelchairs for senior citizens, we don't pay more than we should. And there's been great success there, and examining what it is that's working and where the opportunities are for getting cost savings is something that we can identify. Fourth point is that people don't live in government agencies. They don't live in government programs. They live in their communities, and what they want is those programs to work where it is that they live. And thinking about the way in which different government programs and cross-cutting faction come together in individual communities and work or don't work, looking at government from the bottom up as well as from the top down is an opportunity. And then finally, a careful and systematic look at what it is that is working, so that occasionally at least we can identify practices that offer the most promise, provides opportunities as well for moving the ball forward in addition, I think.
All right. Thank you.